I'm House Minority Leader Tony McCombie, and today I'm here with my colleagues to talk about the ongoing headache that the residents across our state face with the Illinois Department of Financial and Professional Regulation. I want to start this morning with a story of a constituent of mine. A couple months ago, had a phone call from a district office. A nurse needing to pay an additional $30 for her license. Come to discover, couldn't pay that $30 online. There was no avenue for her to give a credit card. So I was here in Springfield for meetings and actually walked over to the office, took $30 cash, had to be cash or check only, and paid that $30 so she could get back to work tomorrow, or the next day, which she did in Galena. She could have herself, had I not been here, driven to Springfield. Would have been an 8-hour round trip. It was that terrible snowstorm day. Or she could have went to Chicago to do it herself, also a 6-hour round trip with the traffic. So it just really reinforced what we already know, that IDFPR is too often the barrier for people getting to work. Due to significant delays, breakdowns in communication, lost applications, and overall dysfunction has often resulted in bipartisan frustration with this agency. Legislators, including these two, had a subject matter hearing last summer and called for change. But here we are, still waiting for the agency to take action. We have written letters, we've reached out to the director, and many of us have seen firsthand the pain the agency causes our constituents who want to work throughout the state. It's imperative that this agency comes to terms with its own mismanagement and implements solutions. Not years from now, but today. Where is the sense of urgency? House Republicans want to get people to work, so let's fix the simple things. Let's address the growing procurement issues and eliminate red tape. I have introduced legislation, the License Convenience Act, HB 4855, which will mandate the department to accept electronic payments for licenses and fees. This shouldn't take a bill for this agency to oppose, to do, and the agency opposing the legislation is ridiculous. Why do you ask? Because I also have a license. I'm a realtor and an appraiser, and I can get my license online through the same agency. I can pay for my license online through the agency. So why are they picking winners and losers? Why can some do it and why others cannot? I can actually even, on my phone, buy a lottery ticket. There's exemptions that they are using, and Representative Howe is going to talk about some others through the emergency time, but there is no reason that this should continue. Now I'd like to introduce my colleague, Representative Severin.
Thank you, Leader. I appreciate that. I'm Dave Severin, State Representative from the 116th District. I live in Benton. I have 9 counties in the southeastern and south central part of Illinois, and I'm happy to be here to join Leader McCombie and my colleague, Dr. Howe, to discuss a very important issue that's causing work shortages in critical industries throughout the state. Not just southern Illinois, central part, but throughout the whole state. A few of the reasons for this work shortage are a lack of modern technology, a lack of effective and efficient communication, and an overall lack of planning for the future that has resulted in delays and backlogs for people trying to get their license. My district office has dealt with dozens and dozens, I repeat, dozens and dozens of cases of people who have waited for months, I repeat, months, to get their professional license, from nurses to doctors to cosmetologists to physical therapists, and the list goes on and on and on. We've heard from people of many different stripes who have had the same complaints. Again, months and months. I got involved because of this shortage of workers we have in the healthcare industry in Southern Illinois and frustration of constituents. I repeat again, Southern Illinois, lack of employees and frustration from my constituents. We need doctors and nurses in my part of the state just like every other part. I'm happy to have worked with Leader McCombie and with Dr. Howe and several of my colleagues across the aisle to engage in conversation directly with IDFPR and to meet directly with their leadership to explain the hardships facing my constituents and the industries that are being negatively impacted by the lack of action to fix these issues. We've brought forward a legislative package that should reduce wait times, Again, I repeat, reduce wait times, increase efficiency, and get people back to work. I repeat, back to work in critical jobs across the state. In fact, I've introduced a bill, HB 4570, which will enable cosmetology instructors on college campuses to become more efficient. And so that is so important for those opportunities to happen. And there's also, I want to say this to you, no time to waste. We've wasted enough time with people that have gotten their license and they haven't had the opportunity to go to work. So people are spending their time and money getting trained, educated, certified to perform important jobs, but they can't get their license through the state. We can't let this bureaucracy fail any longer. And with that thought, I want to turn this over to Dr. Howe, who is a state representative here and can share some other thoughts with you. Thank you.
Well, thank you and good morning. I'm Bill Howder. I'm the state representative for the 87th District, and I'm a emergency physician as well as an anesthesiologist. I've been here a number of times talking about medical issues. This one I am very passionate about, and it's a strange thing to be passionate about, but listen, I'm living and every day with this problem, and it's an important problem not only because Illinois is losing. You know, you talk about this time of we're losing population. Illinois is losing highly competitive, highly compensated individuals, whether they be physicians, nurses, nurse practitioners, PAs, nurse anesthetists, physical therapists, veterinarians. I mean, on and on. These are highly compensated, highly trained individuals. We're losing them to other states. Why? Because we can't get our licensing act together. And I've introduced a couple of bills. One of them is 1572. You know, the governor had emergency powers during COVID, and we had emergency licenses that were expedited, and it worked. It worked because we met the emergency public health problem with expedited licensing. The governor's orders, emergency orders, continued. They continued way too long, but we went back to the old snail system and licensing ground to a halt. So my bill is to continue those emergency licenses as long as there's an emergency order by the governor. And one more thing I wanted to say, you know, we had in veto session, we made a procurement process for IDFPR that they would get us a competitive licensing software bid out in 90 days. I want everyone to know that they've missed that deadline. And so we worked with them. We gave them everything they wanted, and there is no solution, software solution to the licensing delays. And we're waiting to hear from IDFPR what that competitive bidding process final verdict is, and then they have 90 days from there to implement it. All of the healthcare professionals in Illinois are waiting. Thank you.